morning once again, and you're welcome to the Teens Hour of the Hope Virtual Revival. I'm Kofi, your host, and today I have Cynthia, my co-host, Dinah as our panelist, and Miss Ade. She's going to be our speaker for today. Cynthia, please can you tell us more about Miss Ade?
All right, good morning once again, and then welcome to the Hope Virtual Revival. We all know the theme for this revival is I Will Go. I am going to make sure you go. Miss Ade is our resource person for today, and she is in the person of Miss Esther Adai, that's her full name, and she is a clinical and a health psychologist from Cape Coast as well. Two things in one. So you should know today is going to be a very great day. And then and then our panelist is Dinah Obenyes. She's from Accra East District. Before we start the ball rolling, I'm going to give you our call lines and then our WhatsApp line so you can call us and also send us your messages. Our call line is 030-295-9065, 030-295-9065, and you can WhatsApp us on 055-96-800-66, 055-96-800-66. You can go on Facebook and on YouTube as Hope TV Ghana and then watch us live. If you can't do none of them, you can download the Hope TV app on Google Play Store or App Store to watch us. Kofi.
All right, thank you so much. Today we are handling the topic managing addictions. But before we get into anything, I'd ask Diana to pray for us to commence the program. Let's pray.
Let's pray. Our eternal Father, we thank you for this day.
Mm-hmm.
We thank you for giving us the gift of life. We thank you for giving us the gift of health. Father, please, we pray that as we are come to begin this lesson, we pray that you give us retentive memory and also you help us to listen and ask good questions. Please, we pray that you be with the resource person so that she will also be brave and preach your word to us. This and many other blessings we ask through your Son, Jesus Christ. Amen.
Amen.
Okay, that's great. Miss Ade, we've been hearing the word addiction. Those of us who don't really understand it, please can you elaborate what addiction really is for us?
All right, thank you so much for the opportunity given us this morning to discuss addiction and then how we can manage addiction. When we talk about addiction, according to the National Institute of Drug Abuse, it says addiction is a chronic relapsing brain disease that is characterized by compulsive drug seeking, use, despite its harmful consequences. So in addiction, there is a compulsive seeking of a drug or a behavior, compulsive using of that behavior or doing, and then despite the consequences that that behavior may come with, the person do not actually look at that, but it's actually the person continues with that behavior despite whatever disadvantage that person may engage in. So someone will ask, so what are addictions or what forms of addictions? In a way, we can categorize addictions into two forms, where we have drug addictions and then we have behavior addictions. So the drug addictions, normally we say substance use disorders or substance addictions. Yes, and with the substance addictions, this way there is a compulsive seeking and then use of a particular drug despite the negative consequences that that drug may have on a person. And so we have example of drugs such as alcohol, we have cannabis, we have caffeine, we have tobacco, we have the marijuanas, there are lots of them. Some even abuse some medications that are given to them when they go to hospital because of whatever conditions they may be going through. And then we have what we call the behavior addictions. And these behavior addictions also comes about as one begin to seek or engage in an activity despite the consequences that that behavior may put that person in. And we have those gambling disorders where people are betting every day. They take monies from home, they use their pay, they use whatever means, some even steal to be able to gamble, go to bet and do that. And then we also have the compulsive buying. People may buy needlessly. They do not need a thing, but because of that compulsive urge to do that, they continuously do that. So they will be buying, you go to their houses and they have everything. As a teen, he wants to buy every new shoe that is in town, every new bag that is in town, every new hair that is in town, so that they will have a lot. It's something within them is pushing them into such behaviors. And then we have the compulsive stealing, where we have the kleptomania. People steal compulsively. Nothing pushes them, they just want to steal. So these are all addictions. And we have also the compulsive sexual behaviors, where people can watch pornography at the extent of destroying their own lives, at the expense of other social engagements, work, and other things. So all these things come in play to form some form of addiction for us. And then we also have the problematic internet use, where people can stick to the internet throughout the whole day without doing anything. Some go to work and they use the productive hours to watch movies, to do all other things on social media, Twitter, Instagram, and all those things, not doing anything beneficial. But because of the addictive nature of it, they find it difficult to restrain. Somebody will ask, so how do somebody get to know that he's addicted? Or he's in the process of getting addicted, or he's addicted to something? One, the first thing that you have to know, according to the DSM-5, that's the Diagnostic Statistical Manual for Mental Health, 5, the fifth addiction, it says that there is hazardous use. So the person is using this drug at the expense of all other things, whether health, whether family, whether job, whatever it is. They do not look at all those things. All that they are concerned about is the use of the drug. There is also social and interpersonal problems, where the person begins to have a whole lot of interpersonal problems, either with family, with friends, with loved ones. People are complaining here and there. The way they react to them differs. Meanwhile, they do not think to have any problem with that. And then there's also neglected major roles. So they go to work, and instead of them to sit at work, they go to school. Instead of them to be in classroom, they go hide somewhere and they're using the drug at the expense of their academics or their work. And people who use drug, one of the things that they also go through is withdrawal. Anytime they try to stop, there's this ill feeling that they go through. And that the dangers or the painful nature of those ill feelings prevents them of stopping when they want to stop. And there's something we call tolerance, where at a particular point in time, somebody will have to use more and more of the particular drug to be able to get the same effect that person was getting when you started. So for instance, you start with one tot of apetache or whatever they call it. With time, the effect that you were getting from that one tot, you won't get that. So you need to take like 4 or 5 to be able to get the same feeling that you were getting from the one. So this tells us that no, this person is getting addicted gradually. And there's also larger amounts of use. So now they begin to use it. Somebody can use drugs the whole night. Somebody can engage in some social media activities, be on the internet the whole day without learning, without doing anything. Mommy will call you, come and do stuff for me. And then you tell mommy, I'm coming. And then the day will break. Still with our phones, still on Twitter, still on Instagram, whatever it is. And then we are still so much engrossed in those things that they have a harmful effect on us. And there's also repeated attempts to quit, but they become unsuccessful. You see, it gets to a time that you realize that no, I have to learn. But immediately you pick your book, your mind will go back to it, and then you go back and pick your phones. You go back to do whatever behavior or whatever drugs that you are engaged in. And then you spend so much time in doing that. So much time. And sometimes there are also physical and then psychological problems that comes. For instance, somebody may use drugs at the expense of his or her liver damaging, at the expense of his mental problem, having anxieties, having depression, experiencing some psychosis here and there. But because of the joy or whatever they are getting from the use of those behaviors, they think to find it very difficult to come out of it. So they are using the drugs at the expense of their physical and both mental health. And then they give up all other activities for that drug alone. So if it's school, they now begin to withdraw from school. If it's work, they begin to quit the job and sit home so they can have time to engage in all these things that they want to do so. And then there's craving, where there's excessive need to use that drug. So anytime, wherever they are, they feel that they should use it. So they always want to find that place where it is comfortable for them to be able to engage in. In clinical setting, what happens is that if people begin to experience these symptoms, anybody that have about 2 or 3 of these symptoms, we say the person is having mild addiction. If it's between the range of 4 and 5, we say it's moderate. Anybody experiencing these symptoms, more than 6 of these symptoms and above, we say that the person have a severe addiction. So depending on the level with which somebody is on addiction will determine the kind of treatment approach that somebody will receive and the makeup of the person as well. So how does addiction come about? When we say addiction, you see, in the simplest way, what we can say is that naturally our bodies and our brains are made up in such a way that whenever we do something that is pleasurable, we get rewarded. And this reward comes as a result of the release of a neurotransmitter we call dopamine into the system. So immediately we do something, when we eat, when we engage in some activities that are very nice and very soothing to the soul, that helps us in our survival, you realize that our bodies give us something. And in giving us that dopamine, it makes us happy all the time to be able to do that. That is why you eat every day. That's why you drink water every day, because the body has been programmed in such a way that once they are released, it's rewarding, something that is rewarding. You want to continuously do that. Yes. So what happens is that when somebody uses drugs, the same dopamine gets released. And something that is to help you always do that. Now, once the dopamine is also being released, if you take drugs, you continuously want to use the drug because you get the rewarding effect that you are supposed to get when you do any other pleasurable activities. So in a very simple way, people begin to get addicted through this means because they want to always enjoy the rewarding aspect of the use of the drug that they engage in. Every first use of a drug or behavior is voluntary. So you can decide to today drink something, thought of appetite. Today you want to go and buy something. Tomorrow you want to engage in some sexual activity, watch some pornography or something. For the first time you do those things, they are voluntary in nature. But with time, you realize that you lose that voluntary nature of it and it becomes a compulsion on you. So you no longer have that control to be able to say, today I'm going to watch, today I won't watch. Now every day that you have to do that because it has turned from being a voluntary to a non-voluntary activities. At the first test of a drug or any other abusive substance or something, you do that to feel good. Over time, you have to do that not to feel good, but to feel normal. Because what you do is that, now if you are taking a drug, at the first time, you just want to feel the goodness of the drug. Oh, you feel a little high and you are okay, good. You are good to go. With time, you will get used to that drug in such a way that without the use of that drug, you cannot behave normally like any normal person. So before you be able to act normally, you have to use the drug. So how many times in a day will you have to use that drug to get normal? So you continue the use of it, and then it gives you more and more problems. When somebody gets addicted, it brings a lot of psychological problems. So their cognitive functioning becomes impaired, where they have problems with reasoning, they have problems with coordinations, they have problems with learning, decision makings, they act in a different ways that are inappropriate, and sometimes they bring in issues to family and friends and loved ones that are inappropriate or could have been avoided if they were not into drugs. So how do we manage all these things? In a very short way. First, in all addiction forms, we need to seek for help. We need to seek for help, either by trying it ourselves or seeking for professional help. So by trying it ourselves, one way that we can go through is deciding that I am going to stop whatever behavior I am in. And being ready to buy in all the problems that will come with you trying to stop them. And then we have the professional ones, which are most appropriate and most effective sometimes because of the nature of which addictions are. And so with the professional one, we have some combinations of some interventions where we have the rehabilitations. And with rehabilitation, we have the inpatient rehabilitation and then the outpatient rehabilitation. We have psychological therapies, we have the self-help groups, and then we have medications. Especially when it comes to drug addictions. In the first instances of when people want to recover, most of the times what the professionals do is to do a detox. And when we say you are doing a detox, you are trying to pull out all the chemicals or all the drugs that is in the person out. And these things are done in a more professional way in order that the person does not bring out some behaviors that are inappropriate. It can even lead to death sometimes. So it is done in a more professional settings to help the person to be able to cope. So we detox to be able to help bring out clear all those substances that is within the system from you to help you to be able to be in a normal situations where other therapies, psychotherapies, and other things can also work. So in the detox, we use some medications are being used to be able to help do that. And detox help us in a way that it helps us to, it helps to reduce the withdrawal symptoms that the person, that ill feeling of stopping the drug. Because the drugs have been pulled from your system, it reduces that ill feeling that you go through when you have to stop. And then helps you to also reduce cravings, that excessive urge to go for it. It helps to reduce that. And then as you go through that, some of the medications also help you to treat other co-occurring psychological disorders that may be hiding around, so that it will help you better, because some people may be using some drugs not because of anything, but because maybe they have some problem somewhere that they want to deal with, but they don't know how to deal with it appropriately, so they turn to drugs to be able to deal with it. So we have behavioral therapies, that's the psychotherapists to help us. And the first one we normally do is the cognitive behavior therapy, where we try to engage the mind, your cognition, that is your thinking, your behavior, and then your emotions. So we bring these things into play and help to put them at par, so that if there are some negative thinkings or some inappropriate ways of thinking, we try to put you on the right path so that you'll be able to function more appropriately. If there are some negative way of feelings, you will be put at an appropriate place so that you'll be able to perform normally as anybody else does. Then we have the dialectic behavior therapy. With this one, a lot of people may use drugs because they are stressed up, because they have self-esteem problems, because they are unable to do certain things worthy for themselves. So because of that, they engage in drugs. This dialectic behavior therapy helps us to be able to help people to improve their self-esteem, help them to be able to manage the stresses that is around them. And as a result of that, indirectly, it helps them to reduce their drug use, and gradually, they become better. We also have a situation where people are taken outside, and then they are being taught a whole lot of things with the environment, with the nature. So the experiential therapist, where people engage in some recreational activities within a period of time to be able to help them control their addiction use and the rest. So and then we have the motivational emotional enhancement therapy, where people are motivated with all forms to be able to control the addiction that they are in. When it comes to rehabilitation programs, we have inpatient rehabs and then the outpatient rehab. People may ask, where will I want to stop addiction. People have been hearing this, rehab, yes. It's not all rehabs that you have to go to the hospital and be there for months or for whatever it is. There are also outpatient rehabs. With the inpatient rehab, it's more or less like a hospital in-bed setting, where people will be admitted and then be monitored for a period of time to ensure that their addictions are being better, they are recovered from the addictions that they are going through. With the inpatients, all professionals come to play in to help the person to be able to recover. So it's like there is more of control, because they will not allow you to be able to engage in any other behavior that you want to. It is a little bit controlled, where whatever you are engaging in is monitored by a professional for you to be able to overcome or help you to battle that addiction that you are going through. Then we have the outpatients. With the outpatients, the person is allowed in a way to be able to do all other things. For instance, you can go to work, you can do other things, but yet still you have structured sessions where you go and meet your therapist and then you go through. So with time, you are also better able to also come out of that addiction. There is one component of addiction treatment that we cannot take out from, and that is the spiritual component of addiction. And so when you go to any rehab, there's that spiritual aspect of it. So what happens is that with the spiritual, people are helped with some particular faith or beliefs to be able to come out from addictions. And so we can have a health sector or a belief sector, addiction center, something. So wherever the person is, they have a group where they can meet, and then with the same spiritual approach, they use to help people come out of the addictions that they are in. Then we have what we call the support groups. With the support groups, the most common support groups we have are the 12 steps. We call them 12 steps because you go through a period of steps of 12 before you be able to come out. And with the 12 steps, we have what we call the Alcoholic Anonymous, and then the Narcotic Anonymous, the AA, and then the NA. What goes into this meeting is that with alcoholic, for instance, Alcoholic Anonymous, you have groups of people who have recovered from addiction, people who have been in addiction for a long period of time, people who are still in addiction, people who have just started. You have a category of a whole lot of people in addiction. So what happens is that anytime somebody is in that addiction and you join that group, you are being motivated. You get all the experiences that you need because they share, they discuss, they see how best, oh, I did this to be able to recover. So when you also go through this, you'll be able to recover. And it may not come as easy as it is, but the members of the group are there to be able to support you to be able to go through the treatment to help you better recover from that addiction. So the same thing happens to those in the Narcotic Anonymous groups. Then we have what we call the smart recovery. With smart recovery, that one brings together people who have behavior addictions. This time we are moving from the drugs to behavior, such as those who compulsively are watching pornography, are doing masturbation, they are stealing, they are doing all those behavioral activities. What happens is that the smart recovery groups bring all these people together because we have people who have also recovered from the same problems. We have people who are still in the same problem. So they bring them all together to be able to help them better deal with the addiction that they are going through. And so once people have experiences, they share, they motivate you, you go through challenges as you want to stop, then they give you how they also went through the same challenge and how they recovered. So you get motivated along the line to be able to overcome those challenges. There are major rules when it comes to addiction recovery. And the major thing that you have to look out for is to create a life where it is not easy to use drugs. So you look at three things. Your high-risk behaviors, that is the people, the place, and the things. Which groups of people do I use drugs when I'm with? You have to identify them. Where do I use or where do I engage in these behaviors? And then what are the things that energizes me into doing these behaviors? So if you have some friends that anytime you are with, you are tempted to use drugs, to use alcohol, to engage in sex in anyhow, you have to withdraw from such people. If there are some places that anytime you do anything anyhow, you have to restrain from going to such places. And all things that may be a hindrance. For instance, you are addicted to internet all the time, being on phone, you have laptops, you have tablets, you have everything. You have to begin to restrain yourself from all these things so that they can help you stay calm and be able to go through the treatment as it's supposed to be. And then you need to ask for help. When you are going through addiction treatment, you should ask for help at any step in the treatment. If you realize that there's something that is not going on with you, ask somebody. You can ask a professional, you can ask a friend, you can ask a family member. So with addiction treatment, you need to build a network of people who can be very supportive anytime you need the help. So that such people will help you with recovery. And so the support groups are very much important when it comes to addiction recovery. And then you need to be also very honest to yourself when you are going through addiction recovery. If you are not honest, it will be very difficult for you to overcome addiction because you always want to lie to cover up for your addictive behaviors. But once you are always being honest with yourself, it helps you to better get recovery that you need. Because for instance, if you are asked today, you go to the therapist and they ask you, how many times have you used drugs today? And you tell the counselor or the psychologist that, oh, today I've not used, or I used just one. Meanwhile, you have used 10. When you do that, you are always pushed to lie more to be able to cover up. But anytime you are being honest to yourself, the mere fact that you tell a psychologist or a counselor that I have used one, I have used two, the shame or the feeling that you go through alone pushes you to, it helps you to be able to restrain from them. So that when you go and you are asked, you say that as for today, I didn't take anything. But if you want to lie, you always lie to cover it up. And then treatment becomes a problem for you. And you need to also practice self-care. When you are going through addiction treatment, you need to practice self-health care so that it will help you to be able to take very good care of yourself in order that you do not veer from what you are supposed to do. Because if certain things are not going on well, you will be pushed more to go into addiction. For instance, if you are stressed, you need to learn some stress management techniques and then always try to relax anytime you are stressed so that the stressful nature of things you do does not push you back into the addiction that you don't want to. And the last thing that we have to look out for when we want to recover is never to negotiate with our recovery. When we are negotiating with our recovery, what we want to mean is that we shouldn't in any way put in place something that will be a deterrence to our recovery. Whatever it is, it could be friends, it could be loved ones, it could be anybody. once you are determined to avoid addiction, be determined to do that. Don't let any other thing that is around deter you from your recovery. Because if you do, the negative consequences will be borne by you, and you have to feel it anyway along the line. Addiction have a lot of economic and social consequences. For instance, we have a lot of drops out from school because they are using drugs. They cannot be controlled by teachers anymore. They feel that they are bigger than teachers, so they don't want to go to school anymore. People leave their work at their expense. There are a whole lot of abuses home because father is using drugs. He's always on high and he's always beating the wife. He's always beating children. He has no consideration for anybody. Children are disobedient because they are using drugs and they are always high. So addiction has a lot of economic implications on us. If you lose your job, what happens? So we have a lot of people who are homeless these days because they have used drugs to the stage that they have sold everything that they need. They have used everything that is around them to be able to buy drugs. And now all the things that they have are finished. So what happens to them? They have to live outside. So addictions have a whole lot of implications on us that if we try our possible best to avoid them, it will help us and make us live a better life. In all, we don't have to leave the spiritual aspect, as I said initially. Prayers work magic. And so if you are going through addiction treatment or if you have any intention of stopping whatever addiction you are in, you have to involve God. Seek for his face. Commit your sins to him, and he is ready to forgive us and make us better than we were initially. Thank you.
Thank you so much, Miss. You're very grateful, and I've much appreciated what you said. I have a few questions myself, and the phone lines are open. The phone number once again is 055 968 0066. 055 968 0066. You can send your WhatsApp questions to this number. Cynthia, please can you give us the telephone number?
All right, our telephone number again was 030-295-9065. 030-295-9065.
All right, thank you so much. Miss Ade, you said the first use of every drug is voluntary, but is it possible that there are hereditary addictions? For example, there are some families that they are attracted to alcohol. So regardless of who you are, is it possible? Are there cases like that? Please, can you brief us on that?
Okay, thank you. Yes, when we look at risk factors or predisposing factors of addiction, we realize that there are some behavioral components. So we say we have the biopsychosocial, where there's some biological aspects which can be from family, gene problems, brain effects, and the rest. And then we also have the behavioral, that's the environmental problems that we go through. So, for instance, if you are always, drugs are always available to you, you will tend to use them more. If your father used drugs, it means that definitely the possibility that you may also use drugs is high because the drugs are always available. So you also want to taste and see how it feels like and why that is using it. So with that, you tend to also begin to use the drug. So there are also family-related stuffs that are related to it, both biological and then environmental. So your father can influence you maybe through the genes or something that will come to you, and also with the environment because he's always using it. You also want to taste and see how it feels like.
All right, thank you so much.
You're welcome.
I'm told you have a caller on the line. Good morning. You're welcome to Hope TV Teens Hour. How may I help you, please?
Good morning. I'm Bisla.
Okay, thank you so much. Thanks for calling.
Hello.
Hello, yes, please. Thank you for calling. Please, what's your question?
Please, I want to ask that if I get addicted to something,
Yes, please.
or something like marijuana,
Yeah.
and even though I do it once in a month, can I get addicted to it?
Can you please, can you do what, please? Can you repeat the question?
Hello.
Yes, please, I can hear you. Please, can you repeat the question? Hello?
I said if I get addicted to some drugs,
Yes.
like marijuana, but even though I do it once in a month, can I get addicted to it tightly or it will be less?
Okay. So, Miss, please, can you take the question for us?
Thank you for that question. Okay, so if you are using a drug, getting addicted to that drug comes as a result of a whole lot of combinations. I mean, a lot of things come to play before you be addicted. So the person is saying he's using drug once every
month.
Every month, yes. With time, you realize that your use will change. So you tend to use it more frequently than the once every month. And then once that begins, then you are nearing the process of becoming addicted to it. And then to your age also plays a very important role. When you are very young and then you begin to use drugs, you tend to become more addicted because at that stage, your brain is still in the process of developing. So it develops with that faulty system of rewarding. And so once you grow up, you realize that you have problems with addiction and then it becomes very difficult for you to recover out of it. But older people, we may say that maybe they have already, their brains are matured enough to be able to so your age and then your gender, they all come to play when you are using.
You said gender. Does that mean males are less likely to use drugs than females, or females are more likely?
For instance, when we look at alcohol, women get boozed easier than men.
Hey, I see.
Because with the female system, it's such that there is a chemical that is supposed to help you break the alcohol. But with the female system, it produces in a more lesser amount compared to men. So if a man takes, he may take a lot because the breakdown, because it produces more, it's able to break down the alcohol earlier. But with women, because it's lesser, you're not able to break, so you get more abused with just a little compared to a man. So these are all the things that come to play when somebody is using a drug.
All right, thank you so much. Diana, please, do you have a question for Miss Ade?
Yes. I want to ask if, like, a friend introduced me to drugs, and maybe my friend takes one tablet of that drug, and the person doesn't get abused, but I take one and it's like I'm getting addicted to it. Like, I don't get it. Is it because we all have different makeups, or it's biological or something?
So you've answered yourself. Because we all have different makeups. You get it? We have different makeups. And we have people who are already predisposed. It's possible that you may have something around you, you have a problem with the brain or something. The way you control stressful situations may be different from the way somebody will control. That is why, for instance, people go through abuse. Somebody go through abuse and come out being somebody better in future. Somebody also go through abuse and the person's life becomes deteriorated. So we all have different energy levels and strength to be able to accommodate certain situations and help solve certain situations. So you may use the same or even lesser, but you may become addicted in time more than your friend who is using every day and is even using more. So the best thing to do is to avoid drugs.
All right, thank you so much. Today you spoke about social media. When they ask you to do something, you're on your phone and you can't really stop. And so because of that, you're kind of addicted. I didn't know I was addicted myself. Okay, I have a caller, so after that, then take my question.
Okay.
All right. So my question is that, does that mean that, okay, someone is online. Hello, good morning, and welcome to Hope TV Ghana. Please, what's your question?
Good morning. Please, I want to ask that if I'm in stress, does that mean that I'm into addiction or it's normal?
If you are stressed, does that mean you're into addiction or it's normal? Please, is that your question? All right, thank you so much for calling. Miss Ade, please, can you answer that question for us?
Okay, thanks for your question. If you are in stress, doesn't mean you are using drugs. The unfortunate aspect is that some people use drugs to get relief from stressful situations. And that is what we are talking about, and that is what we have to avoid. There are better ways we can solve situations than to use drugs. Being stressed doesn't make you doesn't mean you're addicted to a drug or something. But if you are using that drug and that is causing the addiction, or you are already addicted and that is stressing you, that is what we have to look out for. Maybe if the person is already using the drug and that the drug is causing maybe some stressful nature, some anxieties or other things, that we have to look out for, because some of the drugs can put you into mental conditions that you never anticipated can put you in.
All right, thank you so much. So what you've learned is that stress can be a cause for us taking drugs, and it can also be an effect of us taking drugs. Thank you so much. So back to my question. Sometimes our parents try to say, I'll take away your phone, or because you're addicted to the internet. Or when someone is a kleptomaniac, they keep on beating the person for stealing. How effective is that in handling the addictions?
Okay, thank you. one thing that we need more is education. People are not aware that when somebody does this or that, it's a problem that the person needs to deal with. That is why there may be somebody who will be arrested 1,000 times, go back, come back, go to the prison, come back, go and steal again, and they take the person there. Sometimes it's not just that the person just want to steal. People steal anything, anyhow. So the beating may not be a solution. If there's somebody like that, then the parents might identify and seek for professional help so that with time, the child may come out being better than beating. Because if you are beating the child, it won't stop the child from doing that anyway. Sometimes we need to correct them from home. It may not necessarily be an addiction. Just that the child wants to learn some stubborn behavior or want to learn some behaviors that are inappropriate in society. So if that's the case, then the child needs to be corrected. But in all situations, parents need to seek for psychological support so that they can help their children live better lives.
All right, thank you so much.
Okay. There's a question in the house, but before that, I have a question myself.
Okay.
I'm Rejoice, and my question is that what are the differences between addiction and abuse?
Okay. When somebody is abused, or when somebody, when we say somebody is abusing a drug, it means that you are taking the drug more than you are supposed to take it. But in this sense, all the other definition that comes in with addiction does not apply. So maybe you can stop when you want to stop. You get it? Maybe you are not using that drug at the expense of school or work or any other thing. But anytime you want to take the drug, you go and take it, and then maybe at more than you are supposed to. And when you look at abuse, it's not only psychoactive drugs we can abuse. Even medication, you go to hospital, they give you, take para, 2 in the morning, 2 in the afternoon, 2 in the evening. You think that your pain is too much, then you take 3, you have abused drug. So that is the difference. With addiction, we can say that is a little bit of an extreme form of the abuse. When you abuse drug over a period of time repeatedly, that you cannot withdraw from it, then we say that one is addicted to that particular drug.
All right, thank you so much. So addiction is repeated abuse. You have a contribution. It says, thank you, Miss Esther Ade. The best way to deal with addiction is to avoid drugs or anything that can get you addicted, as it's not easy to break away from addiction.
Exactly.
All right, thank you so much. We have a question from Wisdom. Wisdom is from CAS. So he's saying that, Miss Ade, please, how do prayer camps and all relate? You said spiritual component is the most important. Does that mean that you can go to prayer camps and leave out the clinical aspect? Please, what's the question? What's the answer to that one?
Okay, thank you. I don't know much about what goes on into prayer camps, but with specifically faith-based, with the faith-based rehabilitation centers, they have all these professionals also in play. I don't know what goes on, but if there is no professional help with the prayer camps, then the person needs to seek for that professional help in addition to the prayers. But with the faith-based professional settings, we have other professionals, inclusive of the prayers or whatever, the religious activities that they engage in there. So if there's none in the prayer camp, then the person have to seek for professional help.
All right, thank you.
All right. If, Mr. Day, if I could remember very well, you said there are 2 forms of addiction, which is the behavior addiction and then the substance addiction. So can we, if those 2 are available, can we say that addiction is demonic or something? Yes, because as you are saying, we have to put in God to help us stop addiction. So can we say addiction is also demonic?
When you are sick, do you pray?
Yes, I pray.
When you get malaria, do you pray?
Yes, I pray because...
So is malaria caused by a demonic factor?
No, but you see, addiction is in like so many forms, like watching those pornography and stuff. When someone says, like, Bibi abe show, Bibi abe show. So we just want to know if it's demonic.
Well, I cannot say it is demonic.
Okay.
Or it is not.
Okay.
But what I know is that addiction have some biological components that we need to deal with. And then they may be also, because somebody says, they have bought that disease for the person. Yeah. All those things are there, but we do not have evidence, scientific evidence to back that, okay, it's true or it's not true. So what we know is that addiction, whatever it is, can be treated. And then because we do not know that it is actually coming from a demonic family member or whatever it is, they don't want you to go far, whatever it is. When we add the prayers, whatever it is, the prayer will deal with it. And then the professionals will also deal with the biological and then the behavioral aspects that comes with it.
All right, thank you so much. Please have a caller on the line. Good morning and welcome to Hope TV Ghana Teens Hour. Please, what's your name and what's your question?
Yeah, so I want to give a contribution pertaining to the question about abuse and addiction.
Okay. Please, what's your question again? We didn't hear you clearly.
The question was that is there any difference between addiction and abuse?
Okay, is there any difference between addiction and abuse? Miss Ade, or Dan, I would like to take that for us.
I
So
think there's a difference
would
between
say
addiction and abuse. As Miss
then-
Ade said, she said addiction is when you start using it, like it becomes part of you. But then abuse is taking too much of it. Excessive use of something is the abuse.
All right, thank you so much. So, Mr. Ade, with relation to this question, can abuse cause addiction? If someone is being beaten so much, can that cause the person to venture into alcohol or to repeated sexual activity to boost morale? Can that also be a cause of people getting addicted?
Okay, if you say cause of becoming addicted with the kind of abuse you're talking about the domestic abuse and then the rest. With that may cause you to start the use of a drug and then consequently may lead you into addiction. But that will not directly lead you into addiction. So it's more or less like a process. Maybe because you're always beating home, you want to take alcohol to be able to calm yourself down or to be able to forget about that beating that you went through. So that one will lead you into the use of a drug. And maybe the repeated use of it over a period of time will also lead you into being addicted to that particular drug.
All right, thank you so much.
All right. I think there's a contribution here. Said, I'm Kwesi. The best way to avoid addiction is one coming to accept of his or her behavior of that addiction and seeking good and professional help. I think Ms. Ade has said that. So if you really want to stop addiction, you have to accept that you are addicted. Then you seek professional help and then you seek God's help too. Right.
All right, thank you so much.
I want to add something to that. You see, there are people that may not see any problem with the drugs that they are using. And so if you have a friend like that, now the onus lies on you to be able to motivate the person to seek for professional help.
All right,
So together with the family, you can help encourage the person to seek for help. And that through that, the person can also come out. Because some people do not really see anything with the drugs that they are using, even though it's affecting them. For instance, I always use this example. When you see the men on the street naked, do you think they are aware they are naked? If you are naked, will you go outside?
No.
You won't go outside. So their state of mind, it has gotten to a stage that they do not really recognize whatever they are in to be able to live a more appropriate life. So some people also use drugs and they begin to exhibit some of these behaviors. So they actually do not know that, hey, this drug is actually giving me a lot of problems that I need to quit or something. They are not able to do that. And so if you're a friend to such a person, you can also come in, encourage the person through the family, and then the person can seek professional help.
All right, thank you so much. We have a question from Gideon Afford in Kaswa. He says, on drug abuse, aside using a drug more than is supposed to be taken, is self-medication also drug abuse?
In a way, self-medication can be drug abuse. Because you're abusing it. You have not been, who asked you to take it? Who prescribed it for you? No one. So in a way, we can say it's also a drug abuse.
Then
All right.
we are all doing that.
In a way, sometimes we all abuse drugs.
So does that mean that if every day before you learn you have to take para, does that mean you could be addicted to para?
That is, if the addictive nature of paracetamol, it depends on the addictive nature of paracetamol and then your system. It's possible that with time, you cannot learn without taking para. And that one also have a lot of physical conditions. That is your liver damaging. So if you continue the use of it, with time, you want to always take it before you learn, yes, and you are getting into the addiction stages. But that one also even have a more physical damaging to your body than any other thing. So you have to be careful when you are using all these things. Is it prescribed to you? Yes. How were you supposed to take them? 2. You take the 2 and that is it. Anything above that, anything below that, you are abusing the drug.
All right, thank you so much. Ms. Ade, I wanted to ask a question. How can we overcome society? You know, we use negative words in quote because a drug addict we use thief, we use when someone you are a liar, you know. But sometimes we don't realize that these things might even worsen the person's condition.
Sure.
So how do we overcome such societal barriers?
And that is why we are here. So education is the major role. So once you get educated, when you see a friend in school who is always stealing unnecessarily, you don't throw stones on that person, as Jesus didn't do to the woman, the woman.
Yeah.
So what you also have to do is that you also have to encourage the person to seek for professional help, and then support the person through prayers as well.
All right. Please, I wanted to ask this question too, but Cynthia, it seems like you have something to ask.
Okay. Someone is asking that can learning be an addiction? If yes, can someone go mad because of learning? I have not seen you before, but because you are a clinical and a health psychologist, maybe you have had a patient like getting into that situation before.
Okay, so when you talk about learning becoming addiction, when you go back to the definition of addiction, there's a compulsive seeking of that drug, there's a compulsive of that behavior, there's a compulsive use of it, despite harmful consequences. So is the learning the person going through, is it having negative consequences of the person? If yes, then the person needs to withdraw. If no, then it is not addiction. So we need to be able to set them right. That's why I gave us some predisposing factors. I gave us some categories that we can fix ourselves in. So if you be able to identify, okay, I'm doing this, I'm doing that, this applies to me, this applies to that, then you'll be able to say that, okay, I'm doing the thing. It's having negative consequence on me at the expense of my all other things. I'm having social problems with it. Is it giving you problems? So you have to assess all these things. If yes, then you have to withdraw from them. If no, then it's not addiction.
All right.
And then you said another thing.
Yes, can we
learning?
Yes.
Well, I have not seen any scientific evidence that learning actually will lead you into having mental problem. But what happens is that people who learn with drugs can turn out to have problems, mental problems. So if you always have to smoke marijuana before you learn, with time, maybe it's the marijuana that may lead you into having mental problems, not actually the learning. But because you use that to learn, that is what is causing the mental problem that you go through.
All right, thank you so much, Miss Ade. But you know, there's a saying that prevention is better than cure.
Exactly.
And experience is the best teacher, except when it's your experience. So please, can you teach us tips on how to avoid getting into such addictive situations? It's easy with substance abuse. You can say, don't take this, don't take this. But behavioral abuse, how do you avoid getting into such situations? Because sometimes you don't realize. So how do you avoid addictions?
So it comes with self-discipline. As individuals, we need to discipline ourselves and know times in which we have to do certain behaviors and times we're not supposed to do them. We have to know what is right for us to do and what is not right. Why will you watch a pornography? What do you need that for? What would that contribute to your life? So you don't just have to start them before they become addiction for you. And then with the little behaviors, we need to discipline ourselves. You need money. Mommy says wait. You need to wait for the money. When mommy is ready, she'll give you the money. But because your aid, you want to continuously seek for it. So because of that, mommy put the money and then you turn back and go and steal the money. So the continuous doing of those behaviors can put you into addiction. So self-discipline helps us, and contentment in life helps us a lot to be able to avoid all these mental challenges that we may predispose ourselves into.
All right, thank you so much. Diana, please, do you have any questions?
Can we say there's a positive side for addiction?
That is difficult to say because the consequences that addiction comes with, there is nothing that we can say is positive. I don't know if there is something that you know. Fine, then you can share with us all.
But can we say people to get addicted to food, like food addicts?
Okay, so in mental health, we will classify them as eating disorders. Where we have people who overeat, they can eat and eat and eat and eat and eat. So those aspects too are there. Somebody may, but we normally classify them as eating disorders. That people will need professional help to be able to come out from that. So in a way, people may also want to eat and eat and eat and eat, and they cannot do anything than to eat morning, afternoon, evening, night, every time they are eating. So those people are also there, but they are also as eating disorders.
So if what you talked about, if it can be treated, then can we say it's a disease?
Addiction. Yes, addiction is a disease that is treatable. The only challenge with addiction is that most of the time relapse is common. And so we say that's why we give the definition as a chronic disorder, because most of the time, no matter how long you have stopped using it, if you do not take time, you can relapse back into it. And so whatever it is, it can be treated, sure, with professional help and then the spiritual component. You can come out of addiction freely. But if you do not stand firm, you can go back. But relapse doesn't mean that is the end, you have failed, no. It's just telling you that you need to step on your toes more and then be able to fight the problem because it's still hiding somewhere.
I have this one friend, and he came to me and was like, I've been masturbating since like childhood.
Okay.
Like not like childhood, but like at age 12.
Okay.
And like my cousin introduced it to me, so I'm used to it. But I want to stop. So I tell him that if he wants to stop, then he should stop watching what makes him do that.
Exactly.
And he told me, okay, he will stop. So like, he told me last year, so this year, he told me that he's trying, but the more he tries, the more the urge, like, to do that comes, like, but he doesn't know what should make him know that he has defeated that addiction. Like, anytime he doesn't want to do it, then he feels he has to do it. Something pushes him to do it. He wants to know what it is.
So that is addiction. So the person has gotten into the stage of addiction to the masturbation. So in such a situation, the person tried herself or himself to be able to stop, but it wasn't successful. So the best advice is that you should seek for professional help.
Okay, I just want to add to it. Does it mean that when we want to stop addiction, we have to seek professional help? Without professional help, it's not going to work.
It's not definite that without professional help, it's not going to work, but it helps. Okay. It helps to put you more on track. Because when you are doing certain things on your own, sometimes you say, okay, let me put my phone here. I won't touch it. Small time, by the time you even realize you're already using the phone. But when a professional help comes in, they are better able to structure certain things for you to be able to go through. And through that, you'll be fine. Okay. And that's why we will normally recommend that in the worst cases, seek for professional help.
So after professional help, you've done everything you can. Spiritual or physical, they've done everything, but it's not working. What else will you do? Like,
how do you know that it's not working?
Like, you still want to do it. Like, you still
so
do
you
it.
continue. So it means you don't. It means that you are not done with your treatment, unless of course you lie to the professional that you are not doing it. Meanwhile, you are doing it secretly. But until you are able to recover from that stage, your treatment doesn't end. So you always continuously have sessions with your therapist to be able to help you overcome that. Until that, you don't consider yourself as you have been treated. Or sure.
All right, thank you so much for spending time with us on the session on managing addiction. You've learned that the first step to addiction is always voluntary, and by God's grace, let us try not to avoid them. And one is too many, 1,000 is never enough. So let's try and avoid such situations. And also, whenever you are facing addictions, you can always come for help. Professionals, all the hospitals, you can go and ask. There will be clinical psychologists like Ms. Esther over there to help you. But if things are still not going on well, let us all remember that you can always come to God. In Isaiah chapter 40 verse 29, it says, He gives power to the weak, and to those who have no might, He increases strength. Exactly. So let us always come to God. He is going to give us the power to overcome these addictions, and they are and would be able to go and reach others. And by the power of your testimony, many others might be able to stop their addictions. Thank you so much, Miss Esther. Thank you, Dinah. Please, any last comments from you? Any shout-outs? Anyone? All right, Miss Esther there.
Okay, so I send greetings to my family, my mom, Alice, my sisters, Vasti, Dorcas, and then Daniela, my only brother, Samuel. So I send greetings to all of them. And then my paddies in Cape Coast, Sarah, Maggie, greetings to everyone. And the Fokosi family too in Dowenya. I want to greet everybody, all my loved ones and my friends. Right. Daniel too, I say hi to him.
Hey, actually, you know lots of people. Before we round up, I'd like to inform you that on Friday we'll be having a Teens Ask Questions. So you can send your questions from now till Thursday, and on Friday we'll answer them and give you a response that would help you and shape you for a better future. Thank you so much for spending time with us. And until then, until tomorrow, God be with you and God bless you. Thank you.